We're happy to introduce robotic joint replacement surgery at VPS Lakeshore Hospital, Kochi. Behind me you can see Kochi, our joint replacement robot. The importance of robotic joint replacement is we can actually plan the surgery well using the robotic interface before we deliver the cuts and do the overall joint replacement. In addition, we're using an implant that has 30 to 40 years of data on the international joint replacement registries, with also having the Oxinium joint surface implant option. Kochi is a handheld robot, and this is the interface that each of the handheld devices are plugged into. This is a high-speed camera which is used to communicate between the robot and the computer. And we finally deliver the cut on the knee bony surface. The joint surface is mapped using a probe, and you can see over here on the screen we're able to map the entire knee surface before we deliver the actual knee replacement cut. Using the handheld burr and the screen, you can see the cut being delivered to the tibia in an accurate fashion. Finally, after the knee replacement, we can take the joint through the entire cycle of motion and determine whether it's balanced well and optimally for use by our patient. Next time you see your joint replacement surgeon, please do ask them about the advantages and disadvantages of robotic knee surgery. We hope we can see you soon and help you on your joint replacement journey.